Hello, League City. Happy Wednesday, and welcome to our weekly Lunch and Learn. I have a special guest this week, Dr. Keiser with the Galveston County Health District. Thank you so much for joining me today. I really, really appreciate it. We put out the word that you were going to be live here today with me, and we've got lots of questions.
Okay.
Obviously, everyone knows the topic. COVID.
Right.
But there's a lot of things that have happened, frankly, this week with COVID. Let's talk first about the FDA approval to the Pfizer vaccine. What does that mean for us as a community? And I should preface that by saying both Dr. Keiser and I have gotten our vaccines. Dr. Keiser, you actually got your booster the other day, so you're ahead of all of us. So that is, and we are all social distancing, so we're following all the CDC rules. So in case anyone's wondering why we don't have masks on, we're both vaccinated and we are social distancing. So let's start first with the FDA approval.
So the FDA approval means that the Pfizer vaccine is fully approved. It's gone through every regulatory hoop possible. It's been tested, it's been shown to be effective, and it's been shown to be safe. And so that process took well over a year, which is a remarkably fast time, but they didn't cut any corners in doing it. And, there were those of us who were going, when's it going to be approved, when's it going to be approved? Yeah. So I think this has a lot of important implications, which we still haven't fully seen yet. First of all, there are a lot of people that have been saying, I want to wait till it's fully approved.
Right.
Okay. Well, it's fully approved.
Fully approved, yeah.
It's fully approved. So it's time.
If you haven't been vaccinated and you have been waiting,
come get it. You want to come get it today at the health department. We've got our drive-through up and running, drive-through vaccines.
And you're offering Pfizer, right?
And we're offering Pfizer vaccine, so you can get a fully approved vaccine. So I think that's really good news. It also, though, is going to bring up some more controversy because now it's fully approved. That opens up certain legal doors that employers and other people can make it mandatory, and we're seeing that happening more and more. So don't be surprised if you see, particularly if you work in a private business or for the federal government, that you start seeing notices that, hey, you need to get vaccinated.
That it's required in order for you to come to work.
Yeah.
Now, there's already folks asking, okay, I got Moderna, I got Johnson & Johnson. What does this mean for me? Should I go get this one too? What do you say to those folks? I mean, I'll be honest, I got Moderna. I got the Moderna,
Yeah, not yet. I think the full approval is going to come from Moderna, and then it's going to come from Johnson & Johnson as well. And in addition, we've already started boosters in people that are at high risk of getting another infection, and it's because the immunity tends to wane a little bit over time. So for me, I was vaccinated December 14th. I was one of the first people. We're the first group, so we're kind of like the first in line to start getting boosters. And the federal government is really looking at people who are right now the most immune suppressed. But probably within the next 3 weeks, it's going to open up to everybody.
Really?
Yes,
really?
We fully expect that. So right now what we're doing is, there's an attestation saying I'm immune suppressed, and if you come and say you're immune suppressed, we go, okay, right? But, but don't feel like you have to run out and get it now. It really is about 6 to 8 months.
Well, that's what I was going to ask. I got mine in, I think, March. So really, I'm not I'm not ready for that yet.
Right. April, May, June, July, August, September, October.
Okay, so maybe October.
Beginning of November.
And do you wait for anybody to contact you, or should you just go? And how's that going to work, particularly in Galveston County?
Yeah, well, we haven't worked out that system yet. It took us a long time, believe it or not, just to get a full list of everybody that got vaccinated. Because people are getting vaccinated at so many different places. But now we've got that. And I think one of the things I'd like to do is get to a point where when it's time for you to get your vaccine is to start sending reminders out. But people just need to be aware, and when you get to be at about 7 or 8 months, start asking, should I get my booster vaccine? And it's also recommended that people get the same booster that they got before.
Okay, so I got Moderna, so I'm going to want to get the Moderna.
Right, so that's what's recommended, although there have been people that have mixed and matched, and we don't know that that's a bad thing, but we don't know it's a good thing, right? And so that's why the conservative thing is to say, stick with the one you've got, and that way you know that it's going to augment the immune response you had, and you won't have a bad time. So, we expect a lot of demand for this. And we expect to be giving people boosters till the end of the year at least.
Wow.
The good news is that we're also getting people coming in who haven't been vaccinated before.
Yes. Well, and let's talk about that, because regardless, the numbers right now of hospitalizations and new COVID cases are worse than it was this time last year.
Right.
What are we seeing at the hospitals right now?
Yeah, the hospitals are full.
Yeah.
I mean, there's no way around it. We're busting at the seams,
Yeah.
but we're not busting past the point that we can't handle it.
Mm-hmm.
Part of it, though, is controlled. I mean, because basically our chief medical officer, every day he turns away people with COVID from other hospitals. Not people that show up in our emergency room. We're going to take care of the people in our community, but people that come in from other I've got somebody with COVID. Do you have a bed for them? The answer is no. We're full.
Yeah.
So right now, for example, for UTMB, they can handle about 200 people max.
And we're finding, and I've heard this from folks I've talked to, Memorial Hermann, UTMB, Methodist, that 99% of those patients have not been vaccinated.
That's correct.
And that is correct.
That's correct.
So the majority of people that are hospitalized right now have not been vaccinated.
Right. So, for example, we have given 189,000 people a vaccine in Galveston County. Of those 189,000 people, we've had 888 of them get COVID.
Okay.
Of those 888 of them, 27 of them have gotten hospitalized, and 7 have died.
I know there are plenty of folks out there that have their own arguments, but for me, I cannot. The correlation,
it's huge.
It's math. It's science.
Right.
You can't debate that. It's
right.
Clearly those that have gotten vaccinated, your percentage of being hospitalized is
very
low.
Very low. So I think sometimes people get put off because it's not perfect. You know. And anytime I hear a public health official say these vaccines are perfectly safe, I cringe, because they're not perfect.
Yeah.
And there are people that have side effects. And I saw a police officer recently who got one dose of the vaccine. His face swelled up, his eyes swelled up. First time I'd ever seen anything like that out of 100,000 people.
Wow.
Called all my friends. They'd never seen anything like that. And so we just had to say, look, we don't know what happened, but you should not get this vaccine again. But that's a very, very rare event.
Yeah.
There have even been a few people that have died that might have been associated with the vaccine. Sometimes it's hard. I mean, for example, early on we had a very old man who had cancer who got the vaccine and died 2 days later. Okay.
It's hard to,
and it's hard to know,
but what actually,
right. But we still tell people about that, and we include that in the numbers because we don't want to hide anything. And but if you just look at the percentage, it's like 0.0001% of people have died after getting a vaccine that it may be associated with. So you look at that, and it's you're more likely to die driving to get your vaccine.
I'm glad that you said that, because you are more like, and I've said this before, your percentages are more likely to die in a car accident driving down 45 or 610 with all this construction than you would.
You're actually more likely to get bitten by a shark.
You're right. You're right. That is true. That is true. One of the things that I have heard just talking to different friends that I have that work in the medical community that is extremely alarming to me is the age range of folks that are in the hospital. I talked to someone the other day that said there was a 23-year-old and a 27-year-old that actually died from COVID.
That's right.
Because no outlying health conditions whatsoever.
Yeah, that's right. I mean,
that's unbelievable to me. I mean,
well, but looking at the number of people that are getting infected, it shouldn't be surprising. And also look at how we've done our vaccinations. Remember, we prioritized older people first.
Right,
so right now, in our county, 86% of the people over 65 have been vaccinated. 80% of the people over 65 are fully vaccinated. Okay, so we're really good. And those were the people that were dying, and now they're not getting sick.
Right.
They're not getting in the hospital, and so we're seeing a shift. We're seeing a shift down toward younger people.
That makes sense. Okay.
Right, and now that schools are opening up, we're still seeing even more younger people. So we're going to continue to see those curves shifting down. Now, the chance of you getting sick and dying if you're younger is less, but again, nothing's perfect, nothing's zero.
But you shouldn't be. I'm 23 years old. I'm immune. I mean, let's face it. Most young 20-year-olds, it's me against the world. I can accomplish anything. Nothing's going to happen to me. I have a 23-year-old. I know. But you shouldn't think.
You shouldn't think it'll never happen to you.
You should go get the vaccine.
Right. And your 23-year-old should wear a seatbelt, right?
Yeah, and just exactly.
Right. Exactly. And that's how we have to start thinking about these things.
But this is a seatbelt. This is something you should be doing every day to protect your life.
That's exactly right.
Frankly, it's going to look like every 8 months, perhaps, at least. for the booster.
Well, we'll see.
How it goes.
It's really hard to know how this is going to turn out. People keep talking about herd immunity, that we'll get to some magical number. I'm getting kind of skeptical that that's going to happen. But it's also, keep in mind that when we look at, those numbers of 80, 70%, those are quote-unquote eligible people. So if you take the whole county as a whole, including all the kids that can't get vaccinated, right, we're only at about 55%. Okay. So we've still got about half the people that are vulnerable. So we need to get that up somewhere around 70, 80% before we know whether we will reach a herd immunity.
And what do you say to those parents, kids 12 and over rather? Go ahead and get it. Don't wait. And then what about 12 and under? Because that's kind of the number.
Yeah, well,
now.
we're still waiting for the FDA to approve it, and there are a lot of questions, particularly for the younger kids, in large part because of their size of their bodies. And so I think it was pretty much a no-brainer that 16-year-olds are going to act like adults, right? And then the 12-year-olds will probably be very much like the 16-year-olds. But when you start getting around 4 and 5-year-olds, we don't know exactly how much to give them.
That makes sense because of their body size, mass, weight.
Right.
Let's get to the questions because we have plenty that came in already, so we're going to answer those first. If you have a question for Dr. Keiser that we have not yet answered, put it in the comment section and we will try to answer it. So this first one, Jimmy Vaughn was tested a few hours after meeting the governor. Is there a COVID test that can really detect it that early after exposure?
Nope. Sorry.
Okay. Well, alrighty then. Enough said about that one.
But so what you got to do is, if you've been exposed, the next question is, what do you do? And our best answer is you wait 5 to 7 days and then get tested.
Okay. Are you pleased with how the local school districts are handling the return to school? And if not, what would you do differently or suggest?
I think the school districts are in a really bad spot. And we meet regularly with the school superintendents. We have epidemiologists; those are people that study the epidemic. Talk to them on a daily basis, and they're in a tough spot because a lot of restrictions have been put on them from the governor and from TEA, which if they don't do, they lose funding. And so, they're in a.
And that funding is crucial. That's day-to-day operations.
That's day-to-day operations.
That's day-to-day, yeah.
Right, that's day-to-day operations. So, what we have recommended to the schools is that they strongly recommend masking. Both I as a public official and they as public officials currently are prohibited from having a mask mandate.
Do you think the FDA approval will change that at all, though, with the mask mandate?
No, I don't. I don't. A lot of this is being litigated in the courts right now. And the courts are coming down on both sides of it. And so we don't know how this is all going to turn out, but they can encourage masking, and we're seeing the school districts.
Well, I will tell you, I was at a CCISD campus not even an hour ago, and I walked in with a mask. Everybody was wearing a mask. The kids were wearing a mask. A mom was bringing their child lunch. She was wearing a mask. He was wearing a mask. So
that's great.
Yes, it's not mandatory at Clear Creek ISD, but clearly that is what students and staff are following, at least at the campus that I visited today.
Yeah, right. And so, so part of it is a culture change. And so a lot of that comes down from the top, from the administrators down to the principals, down to the individual schools. And I think if leadership says, masking is important, and if you want your kid to wear a mask, we'll make sure that they wear a mask, and we want you to feel safe. And that's what we've been asking them to do. And I think they're trying to do that as best they can.
Next question, and I think you answered this already, but what percentage of Galveston County is fully vaccinated? How many first dose? How is that working so far?
Yeah, so it's going okay. We had more demand for vaccine than we could meet, which is why we started that drive-through at Walter Hall Park, and we were doing 5,000 vaccines a day, running it through there, and then the demand decreased pretty dramatically, which really surprised me. I thought it would kind of trickle off, and it would kind of go down like this, but instead it went
plummeted, right? Everybody who got it was happy,
Yep. But we've seen actually the demand start to go up now. And so right now, of the eligible population, we're at about 67% have gotten at least one dose. Okay. So that's
then who
pretty
do we
good.
Need to push to get it then? Just those who are saying, I don't want to get it at all, or I'm too busy, or
So it really gets into the psychology of why would I get a vaccine?
Yeah.
Right. So there are a lot of people who are afraid, and there's a lot of trust issues, and quite frankly, people don't trust the president. People don't trust the former president. They don't care. I know people that are ardent Trump supporters, and they don't care what Donald Trump has to say about this. And But what they do trust is they trust people they know,
Yeah.
and they
Yeah.
trust, they trust their family members, they trust their own doctor, they trust, their pastors. And so I think, the thing is, if you've been vaccinated, say to somebody, hey, come on, it's time to get vaccinated.
Yeah.
I'm going to go get my booster. Why don't you come with me?
Yeah.
Right, and so we find that people often bring people that are reluctant, and that tends to work better. There's always going to be some people that are just going to say hell no, and they're not going to get vaccinated.
And I think those you're never going to change their mind. But I had
Right.
a friend who was adamant he wasn't going to get it, and his mom, who lives in another state, said, "Then I'm not going to come visit you unless you're
you get it.
vaccinated." And
Right.
he got it. So
He got it, right.
sometimes it just takes that family pressure. I think
It
that's
takes-
the way to do it.
It takes that. I had a friend of mine wanted to go on a cruise, and I was like, oh, okay, no, get it.
Because I really want to go.
Because
there.
I really want to go on the cruise,
It's whatever changes your
Yeah.
mind. I think is what we need to convince people to do.
Yeah.
And if it's not the numbers that we're talking about, and it's a loved one that can convince you to do it because they
Yeah.
want to be protected, which has been so much about what this illness has been about, protecting those who
Right.
may be at risk. What is the current breakdown of vaccinated, unvaccinated, hospitalized? I think we kind of addressed that already.
Right. It's about 95% of the people that are hospitalized are unvaccinated.
Are unvaccinated, and then and of those that are in the ICU, is it about that same percentage?
It's about the same percentage. Once people get sick, it really doesn't matter whether they've been vaccinated or unvaccinated. And once people get in the ICU, they're in a bad way,
Yeah.
regardless of their vaccination status. So, we've set up all these things to try and prevent that. We have antibody infusions now, and so if people get COVID and they're feeling bad, go get an antibody infusion. You can go online and schedule it yourself, and it takes about 2 days to get people in.
Well, that brings up a good question. This is not on the list because we, even at the city, we have had folks that have been vaccinated that test positive. Frankly, have no symptoms whatsoever. Just got tested because somebody else
got it.
tested
Yeah,
positive.
yeah.
But if you were vaccinated, test positive for COVID, what should you do? I mean, what are those? I've heard people say, "Oh, we'll take extra vitamins or get extra sleep," or what should you do? If anything?
There's not a whole lot you can do. If you're generally healthy, the best thing to do is just stay home. Okay, and if you're around family members, tell them. If you have underlying health conditions, even if you feel okay, if you have diabetes, you're overweight, or you have lung disease, we actually are recommending that people get these antibodies because they keep people from getting hospitalized.
Okay.
And so, so in many ways, it's in our interest to get these folks treated because it keeps them out of the hospital.
So if you start feeling symptoms and you've had the vaccine, and I'm saying you suddenly can't smell, or you're having headache, what kind of symptoms should be alarmed? I've had folks that say, I think it's psychosomatic. It might be my allergies. I don't know. What should you, if you've tested positive, really look for to say, I need to call the doctor because I might need to get some of that.
Right. Some of the early things that are concerning is when people have bad diarrhea and
they
get dehydrated, and we're seeing a lot of that. If you're coughing a lot and you just can't stop, or you feel short of breath, absolutely go see a doctor. But a lot of people are just saying that they feel weak and bad all over. And in those cases, it's probably not a bad idea to have somebody take a look at you. And again, do that assessment of is this something that we need to treat or not? So, people can refer themselves, but people can also go to their doctor. Their doctor can refer. And we expect to be doing more antibodies as time goes on.
So if you're having really bad diarrhea, which is bad in general because you get dehydrated very fast, so that is something you should see your doctor about. For having really a hard time breathing, that is something as well that you need to just not beat out on your. I know my husband. Oh, I'll be fine. I'll stay in bed. Everything will be good. At a certain point, you're dragging them to the doctor.
No, you should because those are the guys that get themselves in trouble. And it's sort of like, oh, I'm tough. I can handle this, and then they end up at the hospital. And they're really sick.
And then it's too late almost.
And then the drugs don't work as well. Our drugs we have are not really effective. They're not like penicillin, where we give you something and boom, it goes away.
It's not like getting that cortisone shot, right?
No,
you immediately feel better.
No, it works. It works okay, but it works best if we can catch people early. So if you're unsure, call your doctor. If you feel bad, go see somebody. Let them decide whether you need something if you're not sure.
Is there a separate test for the Delta variant, or is it still pretty much the same test we're all getting?
So here's how it works. So basically what happens is that everybody gets the same test. And then what we do is we take a sample of those tests every week, and we send them to the Galveston National Lab where they have research scientists, and then they're able to sequence that entire virus and tell us what variant it is. So it's done, it's a random sample of the test. At one point when we started seeing things really jump up, we were sampling as many as we could, and when they hit 100% Delta, we stopped doing.
So really, it's the Delta right now.
Oh, it is 100%.
Absolutely the Delta.
It's
not,
100%,
okay.
and we're monitoring for other variants all the time, and it hasn't changed yet.
Okay. What would it take to issue a health order to Clear Creek ISD to require masks or shut down the schools? Well, how high would the numbers need to be for this to happen? And I know it seems when you have a child that's at school, and I understand. I get.
No, let me go through this because
Yeah.
we've had a lot of questions about that, and the Attorney General has actually issued guidelines, and so I think the rules are very clear in which we're operating. So I cannot order people to wear masks. All right. I can, as a local health authority, quarantine individuals if they're infected, and we can close down a building for a period of time if there is, quote unquote, a contagion inside, with a view toward cleaning it out and getting people back in it. So I can't just say, okay, all schools are closed, or I can't say, Clear Creek High School is closed, period. We can say, okay, we're going to close it for a period of time. So what we do is we very carefully follow all these numbers of the schools, and we see what what not only the cases, but also the proportion of cases in the school versus other schools, and also in the general population. And last year we actually had one high school, and it wasn't Clear Creek ISD, where they clearly had a lot more transmission in that school than, and we were considering actually closing the school for a while.
So parents need to know that you are monitoring all the campuses
all the time.
In Galveston County.
All the time.
So if you're freaking out, and I know how this works, rumor mill, right? Rumor mill's happening, and you have heard every teacher's tested positive, 90% of the kids are positive, nobody's doing anything. No. That would not happen because you guys are monitoring. If you got to like 95% of the school testing positive, you would intervene.
Yeah, we would intervene at that point. And so the first intervention is to go to the school and say, okay, guys, you got a problem. What are we going to do about it? And so, just an example, last year we went to the school and we said, hey, it's a real problem. We're thinking about closing. And they said, well, wait a minute. We've done this, and this. And so after talking about it, we agreed to wait. It was a weekend. We agreed to wait over the weekend, and sure enough, the next week their numbers were down. What they did worked. So our goal is to be collaborative, to work with the schools, to keep kids in schools, but also keep kids safe. If we have to, we will.
Okay. I think that's important for parents to know, because I know a lot of parents are concerned, right?
A lot of them are very concerned.
I don't want to send my kid to school because everybody in the class has it, and so know that that's very reassuring as a parent to know that you guys are actively monitoring the cases at the campuses. And frankly, I know CCISD has been doing a great job daily reporting what's going on in the campuses. Right,
and we're actually working on an app that people can look at, so they can look at all the school districts and all the schools.
Oh wow!
And it'll probably be several weeks away before we get there. It just takes a while to put all this together. We are seeing more cases in schools. There's no doubt about that.
Well, and because everybody has gone back to school, and we have a lot of kids 12 and under that can't get vaccinated.
They can't get vaccinated, that's right.
Next question, have we seen any other variants, i.e. Lambda, in Galveston County? If so, how many cases? Does data indicate vaccines help with other variants besides Delta?
Yeah, no Lambda yet, and we're monitoring for it. And everything we know so far is that of all the variants, there's Delta Plus, there's the other Delta Plus, which some people are calling Delta Plus Plus, which makes it sound like it's worse than Delta Plus, but it's not. But from what we can tell with all of these different variants, that the vaccines that we currently have in the United States are still effective. That's not true worldwide. There's a Chinese vaccine that was very widely used, which has not been effective against Delta.
Oh, wow.
Yeah, it's called the Sino vaccine. And but here in the United States, the FDA has done a good job and has only let those through that really work.
Well, even more reason to get a vaccine, because we are going to continue to see variants. We are going to be an unlimited amount of variants, I would say, in the next 8 months. Is that the case as we see more things change and develop?
Yeah, I hope it doesn't go on that long, but it would surprise me.
Well, I know, right? But what we were saying, 18 months ago?
Right, I know, really.
If a member of your home gets COVID, they isolate and other members self-quarantine. My question is, when or how often should members of the home get tested to ensure the virus has passed? Well, first of all, that's let's go back to that. That was how it was when someone tested positive. Remember the news reporters that were locked in the basement and they were sliding food under the door and all of that craziness. So if somebody tests positive in your home, what do you do first as a family?
So the first thing is that you've got to assess whether the person is likely to be infectious. And so basically what the rule is that 10 days plus at least 1 day without fever. Okay. So that doesn't mean 11 days. So that means if someone's totally asymptomatic, that person is potentially infectious for 10 days. So that person probably should, be somewhere by themselves.
Hang out in your bedroom, be by yourself.
Right. And when
you don't need to be sliding food under the door.
No, you don't need to slide food under the door. Have them put a mask on. You put a mask on.
And that's what
that'll be enough.
Yeah.
For you, basically 5 days plus a negative test.
Okay.
Okay, those are the rules. 5 to 7 days plus a negative test. Now, there's always the argument. Well, what if they get, infected on the 9th day of the other person's quarantine? Can that happen? Yeah. Does it happen very often? No. Okay. So just for the most part, common sense stuff. Have them stay away. You wear a mask. They wear a mask. When they're clear, you get yourself tested and you'll be clear.
Well, and that's a good question. Someone in your house is tested positive. They're self-isolating. Should you yourself just immediately go get a COVID test if you've got no symptoms at all?
No, I would wait. You should wait. But the other question is have you been vaccinated? Right. Because if you've been vaccinated, the recommendation still is that you don't need to be tested and you're okay as long as you're asymptomatic.
Okay, so that's good to know that even if someone in your home tested positive and you got the vaccine and you are showing no symptoms whatsoever, there is no reason for you to go get a COVID test.
There's no reason for you to get a COVID test unless you start feeling bad.
Okay, that clears up a lot of things. I appreciate that. Let's see. Are some breakthrough cases being labeled as pneumonia? And how many breakthrough deaths are pending autopsy? Boy, these people are getting very specific. So let's do number one. Are some of those cases being labeled as pneumonia? Do you think?
Well, I don't know. I think I can't speak to what a lot of times people hear stuff nationally, right? And I can't speak to that. I can only speak to what's going on here. And I can tell you right here, everybody's getting tested for COVID over and over and over again. Yeah. So we're not seeing people that are having breakthroughs saying, "Oh, you don't have COVID, you have something else." That's not happening here. So far, we've had 7 people die who have had breakthroughs. Okay. And all but one of them were very elderly. One of them was in their 60s but had a lot of comorbid conditions. And compare that to, I honestly don't know what we're up to today. I haven't seen the number, but roughly about 420 people have died in our county, in our community, who were not breakthroughs. Okay. So we try and be as upfront with these numbers as possible. Somebody had argued to me, well, they probably died from something else, so we shouldn't report it as a breakthrough death. And I'm going, yeah, but we want to be upfront, and people need to see that information. So if someone had COVID and they die, we report them as a COVID death. Yeah.
Well, I think it's very similar to diabetes as well. They may have not died from diabetes, may have a stroke or heart attack, but it's complications from diabetes. It's the same with other illnesses that are out there. Are COVID antibodies as good at protecting you from future infections as the vaccine? So basically, I think they're asking if I had COVID, is that as good as the vaccine? And I've had that question. I had COVID, I don't need the vaccine. What is the answer to that?
Well, the answer is sort of.
That's a good one. Okay.
So what we can know so far is that if you had COVID, your likelihood of getting COVID again is much less than someone who hasn't been vaccinated, but it's higher than people who have gotten the vaccine.
So even if you've had COVID, you frankly still need to get the vaccine.
You probably should get it, yeah.
And is it too because of the variant? Because there's a different strain than what you might have had?
Well, we don't know that yet because we still haven't we don't have enough experience with this and haven't had enough numbers to see whether Delta is more likely to reinfect people who have gotten something else before. We don't know that. But what we do know is that, if you get the vaccine, let's just say, that's an even chance of you getting it again. Well, if you've had COVID, you're about 3 to 4 times more likely to get COVID again. All right. But if you've never been vaccinated and you've never had COVID, you're about 70, 80
Oh, wow.
times more
Okay.
likely, right? You know, so yes, it does give you some protection. But if you want to make doubly sure, get at least one shot.
Okay.
You
Okay.
know,
So if you had COVID, it's not necessarily that guarantee. You are not.
not.
It's not a guarantee, and so
No.
really you should get the vaccine. There's.
Right.
I mean.
Right.
Okay.
Right.
Oh, how many people have been injured and have died from the COVID vaccine? And that's kind of a hard answer. We talked about it earlier.
Yeah.
But
So there was this data was actually published today. I think it's about 370 million vaccines have been given in the United States, and there have been about 6,000 deaths that may have been related to the vaccine, and that gives out to a death rate of about 0.0001%.
So is that the same as getting bit by a shark? Do we decide? Or is
Yeah,
it,
it's probably less than getting bit
getting
by a shark. You know.
and probably being in a car accident is much higher.
Oh, but getting in a car accident is
Yeah.
clearly much higher. But I don't want to minimize it and tell people that there's no problems. Most people who get vaccines will get the vaccine will have some soreness in the arm and some fever. I felt worse after my second vaccine. I felt terrible. My third one, I felt fine. It's very odd. I don't understand it. So I think we can count on, you're going to feel bad for a day, and I tell people that just
same thing with me. Second shot, felt bad for a day, but then
Yeah.
woke up the next day and was fine.
Fine day, right? Plan on taking the next day off.
Yeah,
But otherwise you'll be okay.
Can you get the COVID booster earlier than 8 months, and how early?
Yes.
Should.
Yeah, good question. I think if I were older, if I were, in my 70s or so, or I had, a lot of...
Have some oxygen maybe?
Yeah, or,
breathing
something. If you have something
like
that puts you particularly at risk, I would say at 6 months is fine. Go ahead and get it. And I got to tell you, we are not being really particular. Some places have said, oh, you need to bring a letter in from your doctor. We're not doing that. Just if you tell us, it's time for my booster.
Consult with your doctor. They're going to tell you.
Oh, of course you should.
They're going to let you know if it's
Sure,
time or if
sure.
you're a candidate for it.
But we're not going to be we're not the
You're not
vaccine
gonna be the police.
We're not the vaccine police. So if you want to come and get it, we'll give it to you and we'll take your word for it.
What percentage of our population has had COVID?
So we've had 42,000 people
This is in Galveston County.
in Galveston County have had COVID, where our population is now officially over 350,000. So that puts us about 13%.
Okay. You're good at math. I'm impressed with all of your numbers that you're remembering 18 months later. If you test positive, will they tell you if it's COVID or Delta?
We will tell you it's COVID. We don't have the means to tell you it's Delta unless we do that special testing.
This question also said they appreciate all you do and everyone at the health department.
Well, thank you.
So I wanted to give that shout out.
Yeah, we appreciate that.
We still have time for some more questions, so put them in there in the comment section. This one just came in. You said wait 5 to 7 days to get tested if you are exposed. Should you quarantine that week before you get tested?
Yes.
Some people can't because of work.
Yeah, I know, right? But and this is a struggle that we've had.
But again, we said too, if you're vaccinated. So should you wait if you're exposed?
If you're vaccinated and you're exposed, it's okay.
Oh, it's okay. So
it's okay.
So it's okay. You can go to work.
You can go to work, right?
Okay.
Now, if you're in the healthcare field,
well, of course.
and you're going to be seeing sick people, you should talk to your bosses about that and see what their policies are.
But if you've been vaccinated, you can go to work. You do not need to. And that's again, no symptoms, feeling great. No reason to get tested, and you can go to work.
You should be okay. And if you're worried about it, wear a mask while you're working.
Okay, that's a good. And for that 10 days, and then that way you don't need to worry about it at all.
Yep.
What did we not ask that you want to get out to people, or that you've been asked in the last?
Get vaccinated. I mean, that's the thing. It's we've got plenty of it. This thing is about as safe as it gets. Okay. It's so funny. We saw a young woman in our clinic this morning who was sent for evaluation for a heart transplant, and so they send them to the infectious disease doctors to make sure, because we're going to suppress their immune system.
Yeah.
Right?
Oh yeah.
And I don't want the COVID vaccine. Okay, so let me get this straight. You're willing to have somebody put you under general anesthesia, stop your heart,
remove
cut it out, and put another one in, and then give you all these drugs, but you don't want to take this vaccine.
Oh, wow.
Is that what I'm hearing? Yeah. Well, they're not going to give you your heart transplant unless you get the vaccine.
Right, yeah.
Okay, I'll get the vaccine.
Wow.
I know a lot of people have concerns, and I think a lot of people have really they kind of taken a position and they don't want to back off. And so just, it's time. Rethink it. Come on. We're having more cases than we've ever had. We're having a lot of people dying. You may know people that have died.
Well, I think, and I got my vaccine, right, one of the first as I could, but what just shocked me when I heard 23-year-olds, 27-year-olds, 30-years-olds dying with really no health conditions to the point, and that just makes you, that's senseless. That's just senseless in my opinion.
One of the things we have to prepare ourselves for is we may see some children dying.
Wow.
And it's not that this is going, I'm not trying to be a fearmonger and say this affects children worse, because it doesn't. And children generally don't have it nearly as bad as adults. But just the sheer numbers that we may be seeing, and so that's
especially
why
with everybody back in school.
So that's why that's why it's important. Parents, whether your school has a masking mandate or not, just tell them, go ahead and get. I want my kid masked. Okay.
Mm-hmm. And frankly, they've been doing it for the past year. You know what I mean?
They've been doing it. They're used to it. They've got it.
So used to it that I keep. You're at home and I see kids wearing the mask or in the car wearing it with their own family. You're just so used to it.
It's not the kids. It's the parents.
I know.
It's like you can't make me. And I go, I know I can't make you. Okay, I'm not trying to make you. I'm trying to help you understand that this is a good thing.
Yeah. Thank you so much, Dr. Keiser, for joining us today and
thank you for having
answering all these questions. We don't want to get political. We know it's a personal decision, but from the science and the health professionals, get vaccinated. Yep, absolutely.
Yep.
Thank you, League City, for watching, as always, and I'll see you again next week for another Lunch and Learn. Stay safe and get vaccinated.